Welcome back to our program. I'm glad that you've tuned in today. We have Dr. Keith Barbour from the Rehabilitation Specialists right here in Monroe, and we'd like to welcome Dr. Barbour to our program. It's good to have you here.
Thank you, Joe. It's a pleasure to be here.
And I don't want to get into confidential things, but I will tell you this. You may not remember this, but my wife was a patient of yours several years ago, and I'll tell you what, after all the attempts that she made with a chiropractor, and she came home in pain, and I said, boy, I hear some really good things about Dr. Barbour. Maybe you should try him out, and that was the ticket. You got her back to good health, and I know she appreciates it, and so did I. And when we heard that you were willing to do a program, I thought that'd be a good thing for our listeners. So it's good to see you here.
Well, thank you very much, Joe. I appreciate the feedback.
You're welcome. And Doctor, you've been here for several years.
Yes, since 1988.
And I know the office was located at one time, I think you were off Stewart Road or somewhere in that vicinity, but you're located elsewhere now.
Yes, now we're on Monroe Street, just at the corner of Jones and Monroe, across from Kroger, just town side of the McDonald's, in the Center for Progressive Health and Wellness.
And those are all important landmarks here, because I'll tell you what, if you're from Monroe, we know where Jones Avenue is, because that's where the Monroe County Fair Parade starts, and McDonald's. I mean, let's face it, it's sort of a landmark too.
Right in between.
All right. And how big of a staff do you have?
Oh, I keep about 20 people on staff, generally.
Wow. I guess I didn't realize it was that many.
Yeah, we have in the new facility, I say new, about 7 years now, 7,500 square foot. We've got an aqua pool, we've got a hot tub and a sauna and a float tank, isolation tank. We have a multi-purpose room where we do the physical therapy, the manual therapy, special events. And then we've got the doctor's offices and exam rooms and massage therapy and a C-arm for more invasive procedures.
And so generally, is there any age population that you seem to really focus on, or?
Well, my specialty is physical medicine and rehabilitation, subspecialty manual medicine. So I deal primarily with pain, weakness, numbness, and disability. And the middle-aged elderly are 80% of my practice. I do see some infants, I see some young children, I see some adolescents, but it's mostly the older working and retired.
And now I'm going to ask you some questions today, because obviously I don't know the answers to them. So please excuse any questions that might just seem right out of left field. But it seems to me that, again, the rehabilitation is really a great means of trying to avoid surgery or to perhaps recover from surgery. Would that be true?
Absolutely. A lot of insurance companies, in fact, now are requiring a rehabilitation evaluation before surgery, because very often it can be avoided.
And I can remember when you worked on my wife, helping her out with a neck problem that she had. We had a heck of a time getting the insurance company at first to want to pay for it. And I thought, are you kidding me? The chiropractic sessions she's going to just aren't working. And I could tell immediately, just from a few sessions from going to your office, that she was able to move her neck, and she was really getting rid of that pain, and eventually is just now pain-free. And so it took a while, but I guess perseverance pays off, because in the end they did cover it. So today we're going to talk about some issues that relate particularly to seniors. So let's start talking about some of those issues. What do we have for our senior citizens here in Monroe County?
Well, one of the big things that we've just started is a balance program. One of the most common injuries in the elderly, as you know, are falls and broken hips, which can lead to serious problems in all areas of health. So we now have a balanced program. We're going out to senior centers and doing some brief evaluations and some simple tricks that people can use to stay upright and avoid the falls. There's a number of issues that seniors face. I like to say seniors and aging, as we're all aging, and we all have to face these issues sooner or later. In this day and age, with the economy the way it is, healthcare, third-party payers, Obamacare, whatever you want to call it, there's some big changes up ahead. What I'm seeing the biggest change is the high deductibles. People are going to be responsible for the first several $1,000s of their health care, and they're going to have to choose. For a long time, I felt it was necessary for the individual to become more responsible for their health care. Now it's going to be pretty much forced upon you.
So, I mean, in addition to, certainly someone could buy more than one policy.
True.
Are you recommending something like that?
I hadn't thought about that. I'm not as familiar with the options. I know that some doctors are offering like a concierge service where they would accept whatever insurance you have, but for an additional fee, make sure you get the care that you need.
Okay. And I want to back up for a second, too, because you were talking about broken hips. Had a family member that unfortunately just experienced that. And you hear from the non-doctors out there, they seem to think they sometimes know more than the doctors do, and I don't agree with that. But sometimes they'll say, which came first? Did the hip break and then they fell, or did someone fall and break their hip? And it's really could be a combination.
Well, yes, that's always a question, especially in the emergency room. Are we dealing with what's called a pathological fracture, meaning it broke first and then the fall, or is it a normal fracture from falling? By far, the bulk of hip fractures in the elderly are from the fall, but they do suffer from thinning of the bones, osteoporosis, osteopenia, and they're more likely to fracture on a fall. If there's a fracture that causes a fall, then that's a very, very serious bone disease that has to be treated.
So that's going to be indicative that just beside breaking the hip, there's probably going to be other issues with bone density, and so they may have some future problems.
Absolutely, yeah.
All right, so on a typical week, as you have some of the elderly patients coming in, what might they expect as far as services available to them?
Well, initially, we would do an evaluation, find out what their condition of health is now and what their concerns are for the future, and physical examination to determine where the strengths and weaknesses are, and then we would build an individualized program to make stepwise progression towards those goals.
And are these people normally being referred to you? Is it necessary that they get a referral from their family physician, or are they free to simply contact your office and make an appointment and become a new patient?
Anybody can contact our office at any time. Different insurances may require a referral. Half my patients come from word of mouth and half come from a doctor referral.
And I imagine then too, as that patient first comes in the door, of course there's always the paperwork to fill out. Things of that nature, but I know a very large part of that is trying to keep that insurance billing straight, and you probably have people dedicated just to that.
Yes, that part of my staff has been increasing.
I bet.
Readily.
I bet. So you said you had something like 20 other professionals working with you, and I'm assuming that some are doctors, such as yourself, and others are just rehabilitation specialists. They don't necessarily have to have a doctorate. Would that be true?
Yes, that's true. Actually, at this point, I have 2 other doctors that are with me every week, and a 4th doctor who's with me just on Fridays. Dr. Abu Shakra is another physical medicine rehabilitation specialist. Rather than subspecializing in manual medicine as I have, his subspecialty is more the interventional procedures, injections, spinal injections, etc. I have Dr. Marguerite Yurkovich, who recently joined me, now 2 years, I believe. She's a pediatric orthopedic surgeon who has retired from surgery and went back and got additional training in manual medicine, as well as acupuncture, and that's probably her real love, is the acupuncture. She gets some very good results in pain problems.
So being a pediatrician, is she restricting her practice now with you to children?
No, she's not. She's treating, again, same population as I do, mostly elderly, middle-aged, some children.
And again, do you involve like any other agencies or other, I don't know, resources outside of your office, or really is everything done right there at your office?
Well, we do refer out to other specialists such as the rheumatologist, the orthopedic surgeon, as necessary. I try to require all my patients to have a family doctor. We help them find a family doctor. We do reach out to the community resources that are available. Cases of hardship, we try to find finance and whatnot. But we like to think of ourselves as one stop for everything. So we've got the doctors all the way from the special procedures to the manual medicine, the physical therapist. One's a doctor, one's a master's prepared. The physical therapy assistants, the physical therapy aides, the manual medicine technicians. We offer a program called Stress Healing. This is also done by a manual medicine technician who has learned how to facilitate the release of stored stresses from the body, as well as train the individual how to prevent stress from affecting them negatively.
And I'm going to imagine that as you have some people come in, sometimes their memory's not very good or their records aren't very good about past treatment and that, and you're trying to develop a history. So in addition to that, I'm going to assume, and you can correct me if I'm wrong, that other family members, even though there's that confidential relationship between you and the patient, other family members could come in and try to assist in that information gathering?
Oh, absolutely. Now that is entirely up to the patient, of course, but I often have helpers, whether it's a family member or another therapist or assistant or a social worker or someone from the insurance company even assist with history gathering and plan development for patients.
Okay, I'm sure that would be of some comfort because I think, and I'm learning as I'm growing older, I need to keep better records too, because as soon as you fill out that paperwork that they're asking for, did you have any surgeries, or when's the last time this happened, or all these particular health disorders, have you had this, or is it in your family? And sometimes you realize you're filling out that paperwork, how much you forget.
Oh, it's so true. I definitely forget far, far more than I'll ever remember. I try to keep my own records as well. It's difficult.
We've been talking about some of the things you probably expect to have happen when you go to a doctor's office. And now we're going to try to talk about some of the prevention things that you can do. And other than an apple a day keeps the doctor away, I think we've got some other advice for you too. So Dr. Barbour, other than that old adage, what are some of the things seniors can do, or those that care for seniors might be able to do to help them avoid some of these visits to the doctor in the first place?
Well, primarily, stay active and stay involved. The number one concern on a recent survey of elderly and aging is health. But by far, the greatest concern about one's health is their mental capacity. Honestly, we all fear that losing our mind, not remembering who we are, and that's not so common. What's very common is depression. And avoiding depression is probably key to many other factors. When we're depressed, we don't move so well, so the body becomes deconditioned. It's a lot easier to lose strength and mobility and balance than it is to get it back. So keeping it is real key, and you keep it by staying active and engaged.
So when we're talking about depression, I can imagine this has been a very, very challenging winter. I've heard people compare it to the blizzard of 1978. I was at the University of Michigan then, and maybe as a college student it didn't bother me as much. This winter has gotten to me. I'm ready to surrender. So isn't it even true that just long durations of adverse weather and not being able to get outside, that certainly can contribute to that depression?
Oh, absolutely. This winter's been terrible for everybody I know, especially the elderly, because you can't get out. And when you get out, it's dangerous. Slipping on the ice, as you know, can be detrimental. A lot of things are available for the home with the new technology. Just playing games is extremely powerful for maintaining cognitive flexibility. Playing games, staying in communication, and any kind of activity, getting out of the chair and walking around. But best is with people. We're much more likely to continue a program if there's other people involved that we care about, that we want to see, that want to see us. So finding a walking program or a exercise program. There's a lot of gyms in town. We're connected to the gym that's now Go Mad. And they're putting in all kinds of new equipment, especially for the elderly, so that people can stay active in a safe environment.
Well, what about those seniors who may not be able to drive themselves somewhere, or maybe they don't have that frequent contact that they're looking for? Is there any type of low-cost items that they could just pick up at the local department store that they might be able to use to maybe replace some of those other activities they can't get to?
Oh, yes. There's really no need for fancy equipment at all. Simply doing knee bends with one hand on the counter is very powerful. The knees protect the back, and just doing slight little knee bends every day can help strengthen the knees and the back. Walking barefoot actually in a controlled environment is very powerful for the balance. Not if you're on rocks or in the yard where there could be holes, but just around the carpet, walking barefoot, taking your time, going slow, just bringing that motion into the foot. Balance is to a very large degree the sensation that is created in the joints as you move. And one of the key things we do in our balance program is improve the mobility of both the feet and the neck. A lot of our balance comes from the neck, and as you know, as we age, it gets harder and harder to turn that head fully right and left. So we work on loosening up the neck, loosening up the feet, and coordinating the muscles so that falls are much less likely.
And I know that some people will experience stenosis where they have like a thinning of a artery or whatever. So are there exercises that can be done to assist that and to assist in blood flow, or is that something that can only be done with surgery?
Yes, that's a very good question. In truth, exercise does help that, but by the time you're seeing a doctor because you have limited blood flow to the extremity, turning that around is going to be very, very difficult. So prevention is the key. And preventing that, not only exercise, but diet. There's been some studies that show even diet can reverse to some degree vascular disease. And that diet is primarily raw or slightly cooked vegetables. One of my favorite studies has been done many, many times, and it shows that with rats anyways, if you allow one group of rats to eat everything they want and give half that much to the second group of rats, the second group of rats live twice as long. So first rule of thumb is eat less.
Everyone says that, and I'll tell you how difficult it is, because in our family, I'm the rat, because my wife will eat half of what I eat, and she's doing better than I am. So, I mean, that's a tough thing to do. I think God gave us taste buds so that different foods would taste so good. That seems to be part of the problem. I've heard people say, well, just eat more often and not as much. And that seems to be the way to go, too. Is that true?
Yeah, that can be a very, very powerful tool.
And I've seen, I won't mention who, but there's someone I work with, and he carries around with him like a gallon of water, and he is just drinking that all day. I know they say you're supposed to drink so many 8-ounce glasses of water, but who's keeping count of that?
Yeah, and I don't know what the truth is there, but certainly water is the substance of life. Without water, there would be no life. Everyone knows that. But from a strictly chemical perspective, every single chemical reaction in the body requires water to make it happen. And there's different qualities of water as well. It's actually a very fascinating topic. Water has a tremendous capacity to heal if it is healthy. Drinking water is a very powerful tool if it's good water.
Yes, I know, and people will, there's that age-old argument about, do you put the filter on your faucet, or are you buying all these different bottles of water out there? I mean, I'm figuring, I'm a little cynical. I figure some of that bottled water is coming from a tap somewhere anyway.
Well, you know it is. I was in Albuquerque a few years ago, and I was at a gas station, needed water, bought something that sounded good, and I read the label, and it said right there, it came right from the public water supply.
Oh, see? So you're just paying for that. That's all you're doing.
Right.
What are some of the other things, you're talking about knee bends earlier, about that that is something that is low impact for a senior to do at home if they can't get outside? What are some of the other things that they might be able to do right in their very own home?
Well, stretching is really the first line of defense. Every muscle needs to be stretched and then strengthened and then coordinated and then endurance. But stretching is what's missing in most people's daily program. Any kind of stretching. Yoga is a very good way to learn stretching. If you can find a yoga instructor that knows how to adapt for the elderly, for the disabled, very powerful. I recommend long, slow stretches that feel good. And then start the strengthening program. So with the legs, knee bends is one of the simplest leg lifts, just laying flat and lifting your legs. If you can get your hips rolled back a little bit, do the bicycles on your back with your legs over your head and bicycling. Some upper extremity work, again, after stretching, some light lifting, infinite possibilities in terms of a home program.
So I know you can find almost anything on the internet, and of course not everything's true. But other than that, because I know some of our seniors aren't real comfortable in using the computer, some are, and so other than that, maybe other than the Monroe County Library, where else might they go to try to find some of these resources?
Well, what I recommend is you come to Rehab Specialists,
I
of
bet you would.
course,
I would
and
recommend that
see
too.
myself or one of the other doctors or the physical therapist and get a thorough evaluation in a home program that can be established professionally.
Are you mostly open Mondays through Fridays, or are there weekends at all?
At this point, no weekends. It's
Okay.
Monday through Friday,
That's typical.
typical. We
Understand.
have some late evenings, depending on what service you're there for.
So what I'm hearing from you today, Dr. Barbour, is that in addition to maybe you've been referred there, maybe you've got a certain ailment you want to address, it sounds to me in order to keep healthy, you could have a healthy visit, just like we have these well care, or whatever they call that for babies, that it's sort of that healthy visit. It isn't just because they're sick. It's sometimes good to see a doctor
Right.
even without that.
Yes, I'm very much in favor of the healthy visit. Start doing something now before symptoms begin to prevent the problem. Prevention is, as you know, what's the saying?
Pound of prevention.
Pound of prevention.
Or an ounce of
absolutely.
prevention's worth a pound of cure. There we
Very,
go.
very true.
We'll get that.
Especially with the need to pay out of pocket becoming more and more widespread. You want to choose what you're going to be paying for. At Rehabilitation Specialists, we have a number of cash services as well as insurance-based services that could go towards that deductible that are very preventative. The manual medicine services, we look to see where your stuck parts are, what's moving, what's not. We try to improve range of motion with some very, very simple hands-on techniques. Very, very different from standard chiropractic, kind of the opposite. Gentle guiding motions as opposed to the full thrusting motions to try to put things in place. We just try to restore normal motion and let the body do the rest.
Well, I'm hoping our listeners here today have gained some knowledge. I have. And I know that as our seniors listen, or those that work with them listen too, it's important that not only do we respond when there's that ailment, it sounds like a lot of prevention can lead a long way to a good and healthy life, which is what we want for all of our seniors. So I want to thank Dr. Barbour for being here today from Rehabilitation Specialists of Monroe. I think we've been running your name and number on the crawl here on the screen. If not, that number is 241-0560. So Dr. Barbour, thanks for being on the program today.
Thank you, Joe. It's been my pleasure.
Okay.